My name is Dr. Ben Kennedy. I'm a haematology consultant. I'm really pleased to be here in Dublin at the inaugural policy roundtable meeting for ECLLA European CLL Association.
And Ben, ECLLA is a relatively new association. We're fairly young as it is. Why do you think it's important to have a new organisation like ECLLA in the field?
Yeah, I think ECLLA is uniquely placed, I think, to find the detail across Europe to improve the well-being of patients. I think to make those strategic alliances and partnerships with clinical groups, research groups and policymakers, I think ECLLA will make a real difference.
And, is this why a roundtable like this matters now? Is it all about turning ideas into action?
I think making those ideas and finding coherent ways of expressing it from different people, different stakeholders around Europe is so important, so that those advocacy groups can share their voice and the concerns of their patients in ensuring that there are the inequities of patient care is exposed and identified and understood, so that things can be levelled out amongst people across Europe.
And there is gaps in CLL care across Europe. What are the major ones?
I think there are several different types of gap. So I think the important ones are the levels of access to high-cost therapies, targeted therapies. I think that's one of the really key ones. There is different access to clinical trials, and that's very important for the well-being of patients and having access to cutting-edge therapies. And then there are slightly softer ones around pathways of referral and the access to psychology support, social support that our patients really don't necessarily get, and these are underfunded across the board, and yet are hugely important to the well-being of our patients. And we need to understand better where those services are developed and how we can really roll them out.
We've seen huge changes over the last 10 or 15 years in treatment plans for patients. What gives you hope for the future? What differences do you see coming down the road?
I think, as you said, the changes in therapy have really improved the clinical outcomes for patients. And I think that's likely to improve again as we understand how best to maximize the benefit of newer targeted agents in combination, seeking the best outcomes for them, but at the same time limiting toxicity. So I think as we move forward, we're finding that balance. We're moving away very much from an age-based approach to a motivational approach, a comorbidity approach, where the access to treatments at a physiological level for individual people is much more open now than it ever used to be.